lots of ways to register. I registered online, so to register online I just needed my identification details. I also needed to know when my last GP visit was, so for me I did it the day after I last went to a GP, so that was very easy to do that online. But we can also use this new assisted registration tool. The first one for the organisation is the Healthcare Provider Identifier Organisation, or HPIO, or HIPPO as some people call it. And then there's provider identifiers, which are HIPPIs, or Healthcare Provider Identifier Individuals, HPIIs.
And how hard is it to get those?
It's not hard. I mean, it's a bit of a cumbersome form. It's not at all hard, and Medicare Locals are there to help you as well. As a healthcare provider organisation, your Medicare Local can help. Once you get your HPIO for your organisation, you need to get a NASH certificate, National Authentication Service for Health certificate. It comes on a CD, and it's basically a digital credential that allows your system to access the PCEHR securely.
So that's a once-only load. You stick that in.
Once only, stick that in, and then once you've done that, you've registered with the PCEHR system, you're in, and you've got your conformance software. You'll actually be able to start accessing, viewing patients' e-health records, uploading shared health summaries.
What if Janet had young kids?
So if she had children, dependents under the age of 18 that are on her Medicare card, we can actually register those through the assisted registration process.
And they don't need to consent?
Well, she's consenting on their behalf.
Right.
So we still need a consent form signed, but it's signed by the mother or father.
And an older child but who's still on your Medicare card?
So if they're over the age of 18, they'd have to register by themselves. And so they could still register using the assisted registration tool. If you have a dependent who's over the age of 18 but unable to make their own decisions, then you need to register using the paper process, and there's a special section in the process, like in the booklet, that's section D.
So even though Janet rules her husband Tom with a rod of iron, she can't register for Tom?
Fortunately, there's no assisted registration for husbands. It's been requested a lot, but no, they do.
Very useful across the country. That would.
It would be very useful, but no, they do still have to make the conscious decision
the man into the
to
surgery
register
is
themselves.
going to be a bit difficult.
Go to ehealth.gov.au, and there's information there for providers on how to register, and that's whether you're a general practice or whether you're a solo allied health provider. The information's all there, and a solo allied health provider can still register and access the PCEHR through the provider portal, which you don't need conformance software. You need internet access for that. Once you actually go through the registration process.
So it's a browser process.
First you have to get those identifying numbers, so the HPIO, the HPII, and they're through the HI service, lots of acronyms there. And then you need to get your NASH certificate, so your National Authentication Service for Health certificate, and then register for the PCEHR. So you sign a participation agreement as a practice or as an organisation, and then once you get all that and get your conformance software, or you get access to the provider portal, you're set. Well, Medicare Locals are there all around Australia to help provider organisations with the e-health system. There's a couple of websites on your screen at the moment. So there's there's ehealth.gov, there's neta.gov.au, there's ehealthkit.com.au and ehealth-act.com.au, where there are resources available for provider organisations. But you can just give your local Medicare Local a call, and they can come out and help you, talk you through some steps, in the process of what you have to go through. Just call your Medicare Local for help. I mean, it is confusing. It's not an easy process to start with, so don't worry about it if you're confused, because there are people out there to help you. We've done it with a heap of practices, so we're used to it and we can step you through it.